Hi, I'm Dior May from Charles Darwin University, and I'm here today to do my Assessment 2 from Exercise Physiology Virtual Coaching. Alright, I have come up with an intermediate pregnancy workout to complete today, and basically we're going to start off with a nice big warm-up. This will help increase the blood flow to our muscles and tendons and prevent injuries throughout this workout. Alright, so we're going to just start off with some arm swings, going around in circles. We'll go backwards to start with, and then we'll go forwards. Whilst we're doing this, I'm just going to talk a little bit more about the workout today. Right, so I have come up with an intermediate pregnancy workout, as I stated before. If you are pregnant in your second trimester, please make sure that you consult with your doctor or physician before starting any workout program. I say intermediate level because this is more a workout for those females who were training at an intermediate level prior to their pregnancy and have continued to train throughout. I did that with my 2 pregnancies, continued to train the whole time. All right, we're going to go into some leg swings now, so going one way around. We'll go forward and then we'll go back again the other way. It's very, very important to do a thorough warm-up, especially when pregnant, because you are releasing a lot of the hormone relaxin into your system, which helps to soften the ligaments and tendons around the pelvis and also the cervix to help you ready to give birth. So we need to make sure that we're doing a thorough warm-up, as you are at a higher risk of injuries whilst pregnant. Going over to the other leg now, around. This is a nice active warm-up just to help get our blood flow going. And back the other way, standing up nice and straight. Make sure you're taking deep breaths throughout the workout. And today all we'll need is just 2 either small dumbbells or anything at home you can use. You could be using cans or packets of sugar, flour to hold. 2 rocks from outside, whatever you can find, get creative. Okay, so the first exercise we are doing today is a dumbbell squat and press. You might have done this before. It is quite a common exercise. So feet shoulder width apart, going into that squat position, hips out backwards, going down to about 90 degrees. We want to hold these dumbbells up at shoulder height. As you go down, bend with the hips. Once you get to about 90 degrees, thrust up and push those arms up above your head nice and straight. Back to the shoulder height, going back down again. As you push up, push those arms straight up above your head. This exercise we are using our glutes, hamstrings, quads, calves, and deltoid tricep muscles, all right? Now if you have got any knee injuries, you don't have to go as low with your squat and push up above your head. If you have any shoulder injuries, you could leave the press part out of the exercise. Okay, so when you go to a wall sit, you're going to need a wall in your house that's nice and supportive. Again, we're going to go feet shoulder width apart and just sit on that wall at a good 90-degree angle. As I said prior, if you do have any injuries, you can go up a little bit higher on the wall, but the lower you go, the more tension you're giving to the quads and hamstrings and glutes, okay? Once you're on the wall, back flat against, nice and comfy position, hold that spot, and then we're just straightening our arms out to shoulder height, okay? So we're not going above and we're not going too low. Again though, if you do have any shoulder issues like shoulder impingement, or you've had a rotator cuff injury, you can just go as high as you can without causing that pinching pain. This again is using our deltoids to help lift the movement, and also quads are the main one that are on fire right now. Okay, our next exercise is a dumbbell reverse lunge with a single leg Romanian deadlift. Again, going into a nice shoulder width apart feet, taking one step back about 1 meter, feet on toes, and going straight down to the ground as if somebody is pushing you down on the head. All right, as you can see, I've got a 90-degree angle between my front and back leg. I'm going to be pushing up through my quad and heel, and then taking that step up. Now for the single leg RDL, you're going to drop the weights down right in front of you, kick that back leg out, back nice and straight, and pull up through the hamstrings and glutes. So that's the difference with the 2. In the reverse lunge, we are more so using a quad dominant exercise. In deadlift, we are more so using our hamstrings and glutes for that movement. Again, going down, if you do have any knee problems, you don't have to go as low with that reverse lunge. And if you have any balance issues, you don't have to do the Romanian deadlift, you could just do the reverse lunge. I'll go through this one again, slight bend in the knee, back nice and straight, pulling up. That takes the pressure off the ACL if we just have that slight bend. And next up, we have a half Arnold press with a wide bicep curl. You might not have done this exercise before because I'm pretty sure I made it up. Okay, so arms at shoulder height, straight in front of you like so. We're going to go outwards posteriorly, keeping our hands facing inward, and then we're just going to straighten the arms out and bicep curl them in. So that's that wide bicep curl going back from that front half Arnie press. As we go back, arms out nice and wide, curl them in 90 degrees and forward. Laterally move them out, bicep curl them in. In this exercise, we are using our deltoid muscles, biceps brachii, brachyradialis and brachialis. 3 exercises in one. We're going to be doing a bent over row, a rear delt fly and a Y raise. Okay, so bent over row, you want your bottom backwards, hips about 45-degree angle, back nice and straight, and we're going to have those dumbbells straight out in front of us, and we're going to row them backwards. So squeezing our shoulder blades together, coming back forward, then going into our next one, a rear delt fly, which is where we have our arms straight, up to about shoulder height and back down in front of you. And then the last one is a Y raise. So we're going to make a Y shape with the 2 arms in front of us, out like so, and coming back down. Now we are using quite a few muscles with these movements, our rhomboids, our lats, our deltoids, our biceps, our triceps, but mainly these are back exercises to help strengthen the muscles that help keep our shoulders back. Great for posture, and especially when you're pregnant, you really want to work on those back muscles. Our last exercise for today, we're going to be doing frog pumps with a crunch. Now, if you haven't done frog pumps before, you're going to lay down flat on the ground, place those weights under your tummy and onto the hips. All right, you want your 2 feet touching, so your base of your feet should be touching together, legs open nice and wide, and bringing them nice and close, so you've got that, again, bend in the knee. We're going to be lifting the pelvis off the ground, squeezing our glutes, and come back down again. Then you're going to do your crunch part of the movement, so bringing those dumbbells up your legs, lifting the chest off the ground, and laying back down flat again. Then do your frog pump, back down, lift up for the crunch. This is a really low impact exercise, and it really helps develop the rectus abdominis muscles, also your glute maximus, minimus and medius, and piriformis. Thank you for joining me for my intermediate pregnancy workout. I'm just going to take you through a couple of quick stretches. So we're just going to have our feet nice and wide and leaning to one side. You should feel a nice stretch through your adductor muscles. And also, while we're in this position, we're just going to raise up our left hand if you've got your left leg out, and pulling over to the opposite side. In this movement, you should feel a nice stretch pull through your triceps and your latissimus dorsi muscles. All right, you want to hold each position for around 30 to 90 seconds, it can be, depends how much time you have. But you definitely want to hold the stretch long enough so that you're getting enough adaptation. All right, we're going to go into the next one, which is a chest stretch, very important. Putting the arm onto a wall and then turning your body the opposite way. So when you do this, you should feel a nice pull through the pec major and minor muscles across the shoulder joint. The next one we're going to do, again holding the wall, is bringing our leg up towards us and pulling the toes towards yourself. You should feel the stretch through your quadricep muscles, and that's what this one is for. The last one we're going to do is just bringing our arm across the body, and we're going to bring our opposite arm up and bend that forward. In this position, if your left arm is crossing your body, you want your thumb to be facing down to the ground. In this movement, you should feel a really great stretch through your deltoid muscle, and we did do quite a few shoulder exercises today, so it's important that we stretch this one out. Again, please make sure that you have received medical clearance before beginning any exercise program. Thank you for your time.